third point is one that's dear to your own hearts here, and that is to change the structure of the way that we deliver our health services. Currently, we're spending something of the order of 18 billion euro. If this continues on its current trajectory, by 2020, the spend will be 37 billion in the health area, as projected by a number of objective bodies. And the same projections would indicate that at that time, from all sources, you might be able to take in 34 billion. So you wouldn't even have enough to deliver on your current health structure, never mind look after so many other areas. So this has got to change, or there will be a serious cost explosion in the way that health is delivered. And we want to put an end to a system that has been health apartheid for so many people who can't get on waiting lists, who, if they are on waiting lists, in some cases have to wait for years. And God knows, in a few tragic cases, some people passed on to their mortal reward before they were actually able to be treated under the current health system. And I want to say this publicly in Carrick. I value the heroism of nurses and doctors and those on the front line who, in really pressurised situations, deliver outstanding care and attention and professionalism to those who come under their care. But it's to get into the system that causes the problem for so many people. How many public representatives from so many parties or none get phone calls every week from distraught people about their family members who have a brain tumour or who have cancer or who need urgent treatment, and they're on a waiting list and they're being told to go to accident and emergency units and stay there until they become an absolute medical priority for admission to a bed. That is not the way our health system should be. And every single public representative deals with queries from distraught people all over our country about this. And that's not the way it should be, and that's not the way it will be if Fine Gael have their opportunity to implement our Fair Care programme. I was actually shocked this week. To hear both the new leader of the Fianna Fáil party and the new spokesman on health both admit that on the one hand, the last thing the health structure needed was a major restructuring. And the new spokesman on health said that the current two-tier system was helping people very well indeed. If ever I saw an example of being in a tunnel far removed from the reality of what's happening on the ground, then those two statements represented that. And if either of them, either the new leader of Fianna Fáil or his health spokesman, want to know what's happening in Irish hospitals, then go around to the accident and emergency units, see those people, elderly and not elderly, on trolleys for 14 and 15 hours, in some cases for more than a day or even two, and they'll soon know that there is a need for restructuring the health system. And the Fine Gael programme, which we call Fair Care, is modelled on the Dutch health system, and that will deal with the waiting lists, with the fact that hospitals should be paid for what they do, and that there should not be a semi-privatisation with co-location of private hospitals on public lands. Fine Gael will put an end to that when we have an opportunity to implement our Fair Care programme. I took the opportunity to visit a number of places in the Netherlands to see the medical facilities that are there. No trolleys, no waiting lists. You can actually make your appointment with a consultant in a very short time. And from that perspective, that health system has evolved to being the best in Europe. And to those naysayers who say that this is a cynical attempt to privatise the health system, they haven't even read what we're talking about. This is nothing to do with privatisation, but rather is it giving everybody, young and old alike, the opportunity to have access to the best kind of health care, as close to them as possible, based on their medical needs, as distinct from what they've got in their pocket.